Traditionally, external defibrillators have used handheld paddles of this type. It's important that these paddles are placed in the right position, and this is the view from the head end of the patient. One paddle should be placed to the right of the sternum, and the other over the apex of the heart, lateral and inferior to the left nipple. They're often marked sternum and apex, although of interest, it's unimportant which way around they're actually used. They need to be of an appropriate diameter, recommended between 8 and 12 centimetres, in order to keep the current density down and so reduce the risk of burns. It's also extremely important that they make a good electrical contact with the chest. This was traditionally achieved with a variety of salty jellies that were smeared on the pads first. These were replaced with the use of disposable gel pads, seen here in their packet, and here the actual pads. These are not adhesive, but are highly conductive. They are placed between the paddle and the patient's chest. It's important that these pads do not touch each other during the defibrillation. It's also important to press hard enough on the paddles. The recommended force is around 80 newtons, roughly 8 kilograms. That's 8 small bags or 4 big bags of sugar on each paddle. And there's good evidence to show that this is often not achieved. While these pads are very useful, they can become polarized after repeated shocks and should only be used for a very limited number of times. They've also been shown not to conduct electricity well enough for ECG recording through the paddles with reliability.